And so the idea of that communication between staff and researchers, between intervention and research, okay, shows here that we have intervention experiences and research results. We put through the activities. If they're research, then there's outcomes from there, and that there's then things that we learn. And we have these feedback loops so that the research team can look at improvement, change, develop different data collection tools, for example, et cetera. And on the intervention side, again, improvement, change, and developing different intervention activities. And we learned over the years that going back and looking at the things that we've done and trying to understand what worked and what didn't, then told us that we have to change our activities. It might be around eating fruits and vegetables, but you can't do the same thing year after year after year. You have to be innovative. You have to find different approaches to doing things and bringing them back. In building that community team or community advisory board, we looked at the different components that make up a community: the education sector, religious sector, recreation sector, environment, community service, the spiritual and cultural parts of the community, and invited people to come together and sit as a community advisory board. Purely advisory. We want community members to come together and hear out our ideas and give us advice and provide us with feedback, and also participate in the events that are going on, so that we can always be tuned into what the community needs, the direction the community wants to go. Even though as staff we were from the community, we're only 2 people. And we have our own idea. Oh yeah, this will work, this will work, this will work. But you still have to bring it back to community and share that with them. And so our community advisory board is, between 1994 and 2010, there's been over 40 volunteers working. It's not the same 40 people all those years. I want to make that very clear. Right now we're about 10 or 11 people working on a community advisory board. We represent organizations, we represent ourselves as community members concerned about the community. And so we support planning we support the planning of the intervention activities, ensure that community priorities are being met. And on the research side of things, ensure that our code of research ethics is being respected. And there's also this involvement from the beginning of ideas right through to the dissemination. And this is one of those places where you see a lot of empowerment happening when people are involved with these things over the years. After many years, it doesn't always have to be the researcher that's going out and presenting the results from research. It's community members that are then able to do that. They're not throwing numbers necessarily up on the board as you would see at, you've been to conferences, academic conferences, and lots of numbers and charts. But to go and talk the community voice about a research project, very empowering to see people find their voice and to go out in public and stand in front and do that kind of thing. They then come back and are that much more champion of the cause. Because when you go out and talk about the work that you're doing, you get energized from that. You get empowered from that. And this year, we were very honored by being recognized by the Canadian Institutes for Health Research with an award of excellence on community university partnerships. So that was a very nice honor to be recognized by research peers, that the work that's been done, in our community with university and Mohawk folks, is been good and consistent and strong enough that people tip their hat to that. So, yeah. The elementary school curriculum was developed by one of the nutritionists and 2 nurses at our hospital from 1994 to 1997. They were traditionally going into the schools and teaching diabetes, nutrition, fitness, and lifestyle. Working with the director of education, they said, let's develop a health curriculum and you folks teach it. The school will teach it and we'll become the supporters of that. So they created the health education program for diabetes prevention with 10 lessons in grades 1 to 6, each grade, and among the themes of nutrition, fitness, lifestyles, and diabetes. very friendly, user-friendly, hands-on, student-friendly, a lot of repetition over the years, and from the very basics of knowing what's the difference between a fruit and a vegetable and being able to name fruits and vegetables, and even to experiencing how the heart pumps for a minute by having a little exercise where the kids do that open and close your fist to simulate the heartbeat for a minute while the teacher continues to talk. And that's always a cool lesson because you see these little kids and they're hanging on. And then that they can then chat and say, okay, that heart muscle that you have inside there is doing that all the time for all those years. So that little kids are then beginning to understand it's not just what you learn in grade 9 biology about the heart, but to actually just kind of do that for a minute, just puts the muscles in your forearm and hands to work. Now imagine this, and then the teachers can talk about and what happens when there's too much unhealthy eating going on and there's fat that accumulates on there, and the teacher will go and grab somebody's hand while they're trying to do that and squeeze it and say, okay, so begin to make children aware. And about diabetes, and about foods, etc. So very, very friendly and practical kind of thing, which has then, again, been honored because other communities have picked it up and taken the content of it and redone it for their needs in their culture, in their geography, in their community. Sandy Lake used this curriculum and as one of the resources, they developed a grade 3, 4, 5 health curriculum on their own, but then they also had this to refer back with and compare. So, it's that mutual support of sharing resources, et cetera. In building a supportive school environment, the project took a written existing nutrition policy that banned all unhealthy foods, but that had been gathering dust, and dusted it off and brought promotion back to the parents and the teachers, got the principals on side to say, okay, we have to enforce this. The community got a big education on diabetes in the early 1990s. That study that Dr. Montour had done went all over the community, went to the schools, went to the parents, even the high school students. Different groups got it, and when they got it, it kind of made people go, holy smokes, that's not good. And so one of the outcomes was a nutrition policy banning junk food. So all you need to do is promote that to give it some teeth, and for people to follow through. We got the principals on side and the teachers on side to move that forward. And so they used to say, oh, well, the KSDPP nutrition policy. We say, no, it's the parents' nutrition policy. Parents endorse that. We're just dusting it off and promoting it. They still call us the sugar police. I mean, I don't work there. They still call me the sugar police. And my coworker, Rhonda, she's been on band council for the last 4 years. They still call her the sugar police, because people had perceptions. They saw us as the front movers and shakers of doing that, and all we were doing was passing on that message. This is how the nutrition policy got promoted. We developed posters of healthy foods, and then had these done up in poster size and then put them up in classes. So put out what you want people to eat. Don't put McDonald's with a big X on it, because people know what McDonald's is, people know what it's all about, and to put an X on it is just to make it all that much more tempting, right? School feasts featuring healthy menus, a lot of traditional foods coming in, corned beans and squash, wild game when you can. The brown bag lunch idea, how to prepare traditional foods. Okay, and so we have corn washing demonstrations. That's an art that I remember as a little kid used to happen in the community all the time when lots of people grew white corn. White corn, we wash it, then dry it, and then grind it, and from there we make cornbread. And it's a cornbread that's boiled in water, and it's a heavy kind of a small size that game they push with the sticks. Curling, yeah. Kind of like a small one of those kind of things is what they look like. They're about this big. I say, you eat that in the morning, you got energy to go all day. When I go biking, I'll eat cornbread in the morning, and it's like, it gives you energy. That's the properties that's in there. It's good for you. That's part of our traditional food. But there's a way that you have to wash it and prepare it, which has been gone for 30 years because people don't grow corn anymore. So they don't watch their grandfathers wash corn anymore. So you start to bring back that which is old and is part of the culture among the nutrition. Hello. Thank you. There you are. Okay. Developing activities that promote physical activity were an important thing to do. We also began to look at different sections of populations that weren't physically active. You got groups of kids in elementary school that are physically active. You know, they love gym class and they play on the school teams. They play on the community teams. They go to the youth center after school and they're playing floor hockey and basketball and boys and girls, different group. But then you've got this larger group of kids that aren't involved, and in that group you got this group that are just totally not involved. So we had a student, a college student, needed to do a little project, so we had him go interview students and find out, non-active kids, and came up with a whole bunch of things that they would like to do. So his little project was then, okay, for a 6-week period in the 2 elementary schools, you set up after-school programming of physical activities specifically for this audience of kids. And when the jocks came around, it's funny to say that for elementary school kids, but you know what I mean, right? That group of kids that just wants to be involved with everything, he would tell them, you guys don't want it, this game isn't going to be a fast game the way you want to play it, Go to youth center. You guys got floor hockey, and they'd be like, oh yeah, okay, fine. And so you got these inactive kids, normally inactive kids playing physical activities, and getting them engaged and feeling good about themselves. Because if your school experience was kind of hanging out and really never get picked for the team or things like that, then you kind of you may tend to shy away from doing those kinds of things. So here, Mike tried to push that out to get more kids involved with that. This was on food tasting over here. They got parents to bring in healthy foods and make breakfast for the whole school. And then the teachers brought the kids out. Not only was there variety, but also portion size. And they brought the actual foods themselves so that, when they go with their mom shopping, they can see, get this kind of cereal, get that kind of drink, visuals, very visual kinds of things. Racers for Health, all elementary school children, and coming from other communities as well, doing a 1-mile run. So now they're starting practice in the gyms at the elementary school. This race takes place in June, but I know just at the meeting last week, the school intervention facilitator was saying that she started putting out sign up for the kids that want to run in the gym after school, getting ready for Racers for Health. So, kind of linking activities together and tying them into key events. Different kinds of walking and running clubs going on. You got a health curriculum, you build in a school environment. And so that's what we just showed you here. So that what the children are learning in the classroom, when they leave the classroom and are still within the school, they're being met with support for that. To reinforce healthy activities, to reinforce healthy eating. And so we go wider out to the community, and we want to have activities that promote healthy eating for the community. So the development of recipe books, food tasting, having workshops on traditional foods, promoting seasonal foods or snacks, having healthy meals for elders who are grandparents and aunts and uncles. And again, one of the things that we found was the community has a mindset of traditional foods, that when we actually kind of take 2 minutes to take a look and trace the history of the food, isn't traditional Mohawk food, it's traditional Kahnawake food, but where it actually comes from is from the French voyageurs and fur traders. It's French food, tourtière, and cooking with lots of pork, pork hocks and shanks and fresh ham and all those things with all that fat in there that's just so darn good. And of course, then you put in all these tons of vegetables, right? So, over the years, or over the centuries, literally, what we were calling traditional food wasn't our traditional food as Mohawk people. It was traditional as Kahnawake people living in a territory occupied by French people, later Quebecois people.